Okay. Knock, knock, knock. Hello, my name is Chrissy. I'll be your nurse today. I'm going to perform hand hygiene and shut the door and curtain to provide for privacy. I will be doing your head to toe assessment today. First, can I have you verify your name and date of birth for me?
Haley Renfro, 21203.
Perfect. And do you know where you are right now?
Yes, at the hospital.
Okay, and you know about what time it is?
Around 5:45.
Okay. Patient is alert and oriented to person, place, and time. The patient appears to be well groomed, well kept. Her body stature is small. Her mood is friendly and attentive, and her speech is clear and understandable. I'm going to start the assessment off asking you a few questions. Have you had any changes in your moles, such as size or color?
No.
Any past skin diseases, such as hives, rashes, or allergies?
No.
Okay, perfect. Going to inspect your skin. Her skin tone is consistent with her genetic background, and there are no lesions present at this time. I'm going to feel. Her skin is warm to the touch, a normal amount of moisture for the environment that we're in. Her skin is firm and smooth and consistent. Then I'm going to check your skin turgor. Just going to pinch your hand. Okay, skin went back down perfectly. No tinting occurred, so it tells me the patient is well hydrated. Next, I'm going to go on to the cardiac aspect of this exam. So I'm going to ask you a few more questions. Do you wake up in the night to urinate?
No.
How many pillows do you use at night?
2.
Is that just for comfort?
Yes.
Okay, perfect. Do you have a history of heart disease?
No.
Any family history of heart disease?
No.
Any swelling of your legs or ankles?
No.
Okay, perfect. I am going to okay, so I'm going to look at your JVD. So I'm going to have the patient sit at a 30-degree angle, and I'm going to have you turn your head to the left. Okay, and I'll have you sit up and do it one more time. Okay, no JVD is noted. Now I'm going to palpate the carotid artery. Okay. The carotid artery is present and not bounding. Now I'm going to use the bell of my stethoscope to listen for any bruits. No bruits were noted. Now I'm going to check the 5 areas. So I have my aortic here. That is the right second intercostal space. We have the pulmonic, which is the left second intercostal space. Erb's point, which is the third left intercostal space. The tricuspid, which is the 5th left intercostal space, and the mitral, which is the left 5th intercostal space at the midclavicular line. So I'm going to use both my bell and my diaphragm to listen. Okay. S1 and S2 heart sounds were noted, no S3 or S4, so no murmurs or rubs. Then I'm going to listen to your apical pulse with the bell of my stethoscope. Okay, I listened for a minute and got 70. Next, I'm going to move on to the lung portion of this assessment. So I'm going to ask you a few more questions. Do you have any shortness of breath?
No.
Do you smoke or use a pipe?
No.
Do you have a history of lung disease?
No.
Okay, perfect. I'm going to inspect. So the patient's shoulders are symmetrical. Her rhythm is normal. Her effort is normal. she's effortless and breathing, and her rhythm is good too. I'm going to do the AP ratio. 2:1. I'm going to inspect. I see no bulging or retractions. I'm then going to palpate. So I'm going to be feeling for any crepitus and see if she has any tenderness with this, and then also check tactile femoris. So, do you have any tenderness?
No.
Okay. There's no crepitus to be noted. Can you say 99 a couple times for me?
99, 99, 99, 99.
Perfect. Tactile femoris is equal bilaterally. I am next going to auscultate and listen to the lungs with the diaphragm of my stethoscope. And I would have the patient breathe with her mouth open. Lung sounds were clear, nothing to be concerned about. I'm then going to have the patient stand up, and I will do the same thing to the back. Skin tone is consistent with the patient's genetic background, no lesions, no bulging or retractions. Her shoulders are symmetrical. I'm then going to percuss. Oh, I think I forgot to percuss you on the front too. Let me just go ahead and do that real quick. Perfect. She has normal tympany. Okay, sorry about that. Next, I'm going to percuss on the back. Okay, perfect. Then same, she has normal tympany. I'm now going to auscultate. Take some deep breaths in with your mouth open. Don't feel rushed. Perfect. Okay. I'm going to check your expansion. So can you take a deep breath for me? Okay. Chest expansion is equal bilaterally. You can have a seat back down. That is it for this one. Now we're going to go on to next. Next we're going to go into the vascular section. So do you have any leg pain or cramps?
No.
Any swelling of your legs?
No.
Okay, perfect. I'm going to first check your pulses. So going to do your radial. And I'm looking for them to be equal bilaterally. Then I'm going to do your ulnar, your brachial. Femoral is in the groin area. And then I'm going to do your popliteal, your posterior tibialis, and your dorsal pedis. Okay, now I'm going to check your capillary refill and your fingers and toes. So I'm going to push down for a minute. Okay. Perfect. Capillary refill is normal in less than 2 seconds. Now I'm going to check for edema in the calves, ankles, and feet. So I'm going to use my hands and press for 5 seconds. Okay. Okay, no edema, no pitting edema to be concerned about. I am next going to move on to the last section of our head to toe assessment. So I'm going to ask you just a few more questions for the abdomen section. So do you have any changes in appetite?
No.
Any nausea or vomiting?
No.
Any abdominal pain?
No.
Okay, perfect. I'm going to ask you to lay flat on the couch. I'm going to put the patient at a 0-degree angle. I'm going to lift your shirt and inspect. So skin color is consistent with the patient's genetic background. Her contour is flat, no lesions to be concerned about. So I'm first going to auscultate to all 4 quadrants of her abdomen. Okay. Vowel sounds are active and normal in all 4 quadrants. I'm now going to use the bell of my stethoscope to listen for any bruits at her aortic. Okay. No bruits to be noted. I'm next going to percuss, and I'm going to do a box method in her right lower quadrant, and then I will perform a zigzag method for the rest of it. Perfect. She has normal tympani in her abdomen in all 4 quadrants. Now I'm going to percuss. I'm going to be looking for any masses and then to see if she has any tenderness. So first I'm just going to push lightly. Do you have any tenderness?
No.
Okay, I'm going to push a little harder. Okay, perfect. Any tenderness that time?
No.
Okay, perfect. I'm gonna have you stand up and I'm gonna check for CVA tenderness in your back.
Hi, my name is Jennifer. I'll be your nurse today. I am just going to sanitize my hands and could you please tell me your full name and date of birth?
Diana Yeager, December 7, 2001.
And I'm just going to ask you a couple questions. I'm going to do a general survey. I'm going to check your vital signs, listen to your heartbeat and your respirations, your lungs, and do a skin, hair, and nails. And I'm just gonna put on gloves and then get started.
Okay.
Go.
Where's my record right there?
Do you have any allergies?
No.
And what brings you in today?
I'm just here for a regular checkup.
And are you having any pain?
No, no pain.
Do you have any medical history?
No.
Any family history?
No. My mom had like diabetes, but I don't think it affects me.
Okay. What do you prefer me to call you?
Cayenne's good.
And do you have any pronouns or?
She, her.
And do you have any religious preferences?
No.
Okay. And now I'm going to start my assessment. And do you mind if I touch you?
No, I don't mind.
Okay. So I'm going to start with hair.
Okay.
I'm just going to look in your hair. Feel everything goes on in one spots. Okay. And now I'm going to check your pupil reaction with the pen light. So I'm going to shine the light in your eyes and see if your pupils dilate.
Okay. Should I take my
Yes,
glasses off?
please.
Okay.
And then I'm going to check your skin turgor. I'm just gonna pinch you and then release, okay? Alright. And I'm going to just look at your skin. And can you smile for me? Can you show me your teeth? Can you stick out your tongue? um, can you hold your hands up for me? And I'm gonna push on your hands and you, don't let me. Okay. And then I'm gonna push up. Okay.
Okay.
And, now I'm going to do your vital signs. So first I'm going to check your temperature, and while I'm checking your temperature, I'm going to put, this is a pulse ox, it's going to read the oxygenation in your body.
Okay.
Okay. 97.7 is your temperature. 98 is your oxygen, and 72 is your heart rate. And now I'm going to check your blood pressure.
Yeah, for sure.
And now you want to feel a tight squeeze. Do you know your the range of your blood pressure?
Like 117 over 68.
Okay.
The last time.
So I got 112 over 72. I got 18 for your respirations.
Okay.
I'm just gonna listen to your I'm gonna listen to your heart. And I know I'm supposed to go in her shirt, but
or being appropriate.
I just listened to the aortic, now listen to the pulmonary. And now, I'm gonna see if she has herbs. I don't hear it, so
No herbs, Mike.
we wanna listen for tricuspid. And now mitral. And I'm supposed to listen for a minute. And now, I'm listening to her, lungs.
Oh,
Yeah. Okay. Take a deep breath for me. One more time. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Sorry. Deep breath. Deep breath. Amen. Sorry. Deep breath. Deep breath. And deep breath. Now I'm going to listen to your lung sounds from the back. Deep breath. 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 Your lungs are clear. Now I'm going to check your capillary refill. And it's within normal limits.
Okay.
And, now I'm going to check your skin. Your skin is warm and dry. And now I'm going to check your range of motion. Can you move your head from side to side, up and down? Can you put your arms out for me? And yeah, and circle. Can you lift your legs up for me? And lower them. Um, Okay, that includes my assessment. The doctor will be in soon. Do you have any questions for me?
No.
All right, thank you.
Come in. Hi, my name is Gina. I'm the student nurse that's going to be helping you out today. Can I get your name and date of birth?
Millie Larson, 12/14/49.
And do you have any allergies, Millie?
No.
No. And any medical conditions that I should be aware of?
No.
No. Okay, I'm just going to check that with your chart. And check your wristband. Okay. Before we get started, I'm just going to be asking you a couple of funny questions, so just bear with me. Can you give me your name one more time?
Millie Larson,
And Millie, do you know where you are right now?
Concordia University, Concordia Hospital.
Okay, and do you know what day it is?
Thursday.
Thursday. And do you know who the President of the United States is?
Joe Biden.
Okay, patient is oriented ×4, no signs of slurred speech or involuntary movements. Okay, so what brings you in today?
I was gardening yesterday and I tripped and rolled my ankle.
Okay, and are you in pain?
I would say it's 3 out of 10.
Okay, so on a scale of 1 to 10, it's a 3.
Yes.
Okay, and have you found anything helps or exacerbates the pain?
When I walk, it's about a 5.
Okay, so walking makes it hurt a little bit more. Have you been taking any medication, anything to make it better? No? Okay, and is that pain that you're at right now, is that tolerable for you, or you have a pain goal?
I would like to be like around a 1.
Okay, that makes sense. So we'll figure out what we can do with your visit today to get that pain down. But while we have you here, we want to do a head-to-toe assessment to get to know you a little better. Is that okay?
Yes.
Okay, so we're literally just going to work head-to-toe and assess your whole body.
Okay.
So I'm going to start up here with your head. Okay, so I see no signs of alopecia or dandruff. Head looks symmetrical. While I'm here, I'm going to check the skin on your coccyx. I don't see any signs of skin breakdown, and skin color looks regular for ethnicity. Okay, since I'm over here, I'm just gonna look inside your ear, okay? Okay, no excess cerumen or skin breakdown for both ears. Okay, we'll move on to assess your eyes. I'm just gonna shine a light, okay? Okay, and then I'm just gonna pull down a little bit to check down here. So sclera is white, no signs of jaundice, and conjunctiva is pink and moist. And then I'm just gonna have you follow your eyes, try not to move your neck, okay? Okay, patient's eyes are perla, pupils equal, round, reactive to light, and accommodating. Now I'm just gonna move on to your nose, okay? If I could have you just tilt your head back a little bit. Okay, I don't see any polyps or excess drainage in the nose. And now we'll move on to your mouth. So if I could have you smile. Okay, and then open your mouth wide. Stick your tongue out. Say ah. Okay, and Millie, do you wear any dentures?
No.
No? Okay, what about any glasses?
No.
No? Okay, so the mucous membranes in the mouth looked moist, no ulcerations. Okay, so we're gonna move on. I'm going to just check your swallow reflex. Okay, so if I could just have you swallow. And do you ever have any difficulty swallowing?
No.
No? Okay, no signs of dysphagia or tracheal deviation. And then I'm just gonna take your carotid pulses. Carotid pulses are 2+ equal bilaterally, and then I'm going to take your temporal as well. Okay, temporal pulses are 2 plus equal bilaterally as well. Okay, and then we're just gonna move on to the lower extremities. So just let me know if you feel this. Okay, sensation is intact in the upper extremities. I'm gonna take your brachial pulses, okay? Okay, brachial pulses 2 plus equal bilaterally. And radial pulses 2 plus equal bilaterally. And then we're gonna assess for range of motion. So if I could just have you here and let's do like the YMCA. Okay, thank you. Range of motion in upper extremities is active, and I don't see any signs of skin breakdown on the elbows. Okay, now we're gonna move on to assessing your chest area, okay? So first I'm going to listen to your heart sounds and then we'll move on to your lung sounds, okay? Okay, so this is your aortic. Pulmonic. Erb's point. Tricuspid, and mitral, and I'm just gonna hang out here for a little over a minute, okay, so we can get your apical pulse, which is located in the 5th intercostal space. Okay, so while I was listening to your heart sounds, I found that your heart rate was 80 beats per minute, and I also listened to your, I got your respiratory rate as well, and that was 14 breaths per minute, and there were no adventitious heart sounds, and S1 and S2 were present. And then now we will move on to listening to your lung sounds. So I'm gonna have you inhale and exhale at every point I listen, on the front and on the back, and if at any point you feel faint or dizzy, just let me know, okay? So we'll do 6 points in the front and 8 in the back.
Okay.
Are you doing okay?
Yes.
Okay, there were no adventitious lung sounds. Can I have you take a deep breath in and out, in and out. Okay, chest was equal rise and fall, so no signs of flail chest. Oh, I'm gonna assess your skin turgor. Okay, I'm just gonna give you a teeny pinch. Okay, so no signs of tenting. The skin looks hydrated. And then let's assess the strength in your upper extremities, okay? So put your hand to mine, press, and then can you pull? Okay, so strength in the upper extremities is 5. And then let's, also I'm going to check your capillary refill, okay? Okay, cap refills less than 2 seconds in all 10 fingers. Okay, we're gonna move on to assessing your abdomen, but before we go ahead and do this, I'm just gonna ask you a few more questions. What does your diet normally look like?
So I typically like to eat 3 meals a day. In the morning, I like to have like oatmeal with some fruit. For lunch, maybe I have like a salad or a sandwich, and then for dinner, I probably have some like chicken, rice, and some vegetables.
Okay, that sounds good. And are you drinking fluids?
I drink about 2 cups of water a day.
Okay, do you maybe not like the taste of water?
Yeah, I just find it like not very exciting.
Yeah, I get that. I normally like add lemon to mine just to make it like a little bit more like enjoyable. So I get that, but we do want to have your fluid level ideally at like 8 cups per day.
Okay.
Okay, and then also, when was your last bowel movement?
My last bowel movement was yesterday night.
Okay, and what did it look like?
It was brown.
Brown, okay. And how often do you have a bowel movement?
About once a day.
Okay. Also, what about with urination? How often are you urinating every day?
Like 4 to 6 times a day.
Okay, got it. Do you have any like pain, any burning when you're urinating?
No.
No, and what about, do you notice any odor ever?
No.
No? Okay. Okay, so I'm just gonna have you lie down so we can assess your abdomen, okay? Okay, is it okay if I just pull this up a little bit? And Millie, do you have to urinate right now
No.
before I'm gonna eventually palpate the bladder?
No, I'm okay.
Okay. Okay, upon inspection, I see no signs of bulges or masses, and the abdomen is non-distended. I'm going to listen to your bowel sounds, okay? Okay, bowel sounds are normal, hypoactive, in all 4 quadrants. Now I'm going to be palpating. Do you have any tenderness in the abdomen?
No.
No? Okay. So I'm gonna start light. Just let me know if you feel any tenderness in any of these areas, okay?
No.
Okay, and then I'm gonna go a little bit deeper. Okay, I don't feel any masses or bulges, and patient reports no signs of tenderness. And then I am going to palpate the bladder, okay? The bladder is also non-distended. I'm going to pull this back down. I'm gonna help you up, okay?
Thank you.
Okay, and then we'll move on to assessing your lower extremities, okay? Let me know if you can feel this.
Yes.
Okay, so sensation is intact in the lower extremities, and then I'm gonna feel for your popliteal pulse. Okay, it's a little bit weak, but that's normal. You could just relax. You could just relax. No. Actually, I'm gonna assess your strength before we move on to working with your feet, just for sanitary reasons. Okay. So first, I'm gonna have you just try to press up on my hand. Okay, perfect. And then we'll move on to your feet. Okay, press down like it's a gas pedal, and then try to press up. Okay. So strength is 5. And now I'm going to feel for actually the pulses on your feet. Okay, post hip pulses are 2+ equal bilaterally. And dorsalis pedis 2+ equal bilaterally. And then I'm just gonna check the Capri flow on your feet, okay? Okay, Capri fill in the feet is less than 2 seconds in all 10 digits. Okay, and do you ever need any assistive devices, or do you feel like you can move around?
I feel like I can move around.
Okay, I'm just gonna help you up for safety. I'm gonna have you step it down. And then if you wanna just hold on right here for safety, we're just gonna look at the range of motion in your lower extremity. So let's just kick out. Perfect. And then left side. And you can kick back. And kick back. Okay, patient has full active range of motion in the lower extremities. And now we're just gonna be assessing like your balance and your gait. So I just am gonna have you walk for me, just a few steps. Okay, gait does look steady. Just a little bit of weakness in the ankle that's injured, but that's okay. We expected that. So just like a little overview of like everything we went over. So the CNA I know came and did take your vitals, and your temperature was 98.8. BP 146/84, and then the O2 stat was 97. Let's see what else. You came in for the pain. Doctor did prescribe 400 milligrams of ibuprofen every 6 hours as needed, okay? We're gonna have you rest and just elevate that ankle, and then you can also apply ice like every 20 minutes, a few times a day. And we would like you to come back in 2 weeks and just do a follow-up with us.
Okay. Sounds good.
Okay. Do you have any other questions for me?
No, thank you so much.
Okay, thank you. It was really nice to meet you.
You too.